Welcome to Health Equity 52 with Conscious by Us. I'm your host, Tahitia. Imagine a world where everyone lives their healthiest version of life. What would that look like? At Conscious by Us, we believe health is key to creating an inclusive world where everyone belongs. Because let's face it, our health impacts and is impacted by literally everything we have going on in our life. In healthcare, we tend to refer to these factors or things as the social determinants of health. They're the economic stability we have, our access to quality education, quality healthcare, the neighborhood and environment you live in, and your social and community standing. So, all of this stuff together works to create the healthiest you. So, with that in mind, I decided to have, or I'm setting out to have, 52 conversations about health, wellness, health equity in particular, with a variety of guests across a multitude of areas, industries, and subjects. On today's episode, we are shining a spotlight on Angel Flight East, a nonprofit dedicated to bridging the gap in access to medical care for underserved and rural communities. Join us as we explore how their free air transportation services are transforming lives by ensuring those in need can access care without barriers. They really have a heartwarming mission, and they have a profound impact on those they assist. Our guest speaker today is Jessica. Jessica is the Outreach and Events Director at Angel Flight East. She brings a wealth of experience and is here to share with us their story. Welcome, Jessica. I'm so happy you're here.
Thank you so much for having me.
Thank you so much for being here. So I would love to share with our audience just who you are, how you got involved with Angel Flight East.
So I have been with the organization for 10 years now, which is kind of crazy to think about. And I went to school in Lancaster, Pennsylvania, if anybody listening knows about it. So I studied public relations with a minor in marketing there. And I interned with the Leukemia and Lymphoma Society for 2 years as their campaign manager on one of their largest campaigns called the Man and Woman of the Year. And after doing that internship, I graduated knowing I wanted to work for a small nonprofit. I've always been drawn to more grassroots nonprofits, all volunteer run, because the money that is raised always goes directly back to the mission. So after I graduated, I started looking for a job and found Angel Flight East on Craigslist, which I'm not sure how reliable Craigslist is as a job search engine in 2024. Yeah, they refer to me as their best Craigslist find, which it's crazy to think about that. That's how I found them. So I have no idea what the job search on Craigslist is like today, but 10 years ago, it was great. So I started out as their first programs and events coordinator, really working on our annual gala silent auction, working on our Wings and Wheels event. And I just kind of worked my way up. I originally thought it was going to be kind of a stepping stone to learn more about how nonprofit organizations work. And I always wanted to work on kind of the outreach and event planning side because I'm super detail oriented, like hyper organized focus. And then I just grew with the organization, and I think our mission is so impactful and it's just very unique. So after 10 years, I am officially our outreach events director, being a key part on all of our fundraising events and then leading all of our outreach initiatives. So to look back, it's been a journey for sure, but I just love Angel Flight East mission, and our volunteer pilots are just so passionate and selfless about helping people who need access to medical care that may not have another way to get there.
That is wonderful. And so I think we jumped right in here just talking about like you getting involved with Angel Flight East. And I would love if you could just share, well, what does Angel Flight East do? Because I know I had heard of Angel Flight East or Angel Flight when I was working as an oncology nurse. And I encountered them by chance with a patient who we were trying to bring in for special services. And they were talking about this program that would be helpful. And I don't think a lot of people know what y'all do and just how amazing the work you're doing is.
Yeah, you're definitely right. We find that so many people are unaware our service exists. So any chance to talk about it or get the word out, like something like this podcast, is always super beneficial and helpful to us. So what we do is provide free flights for patients who need medical treatment far from home. We have a network of volunteer pilots who use their own airplanes and cover all
Wait,
costs of the
okay, I'm
flight.
going to pause you. What did
Yeah.
you do? So the pilots volunteer, and what about the planes?
Yeah, it's crazy to say out loud too, because when I first heard about it, I was like, there is no way there are strangers out there who, one, own their own airplane, and two, would use it to fly a complete stranger to faraway medical care that they can't get to themselves. And that's basically what our organization does, and it's our primary mission. So we have about 400 volunteer pilots within our 14 state footprint. We're based right outside Philadelphia, but we do cover a 14 state footprint from Virginia to Ohio to Maine. So all of these men and women, they either own or have access to a small airplane. Most of them are 4 to 6 seats, and they fly patients who need to access medical care that don't have another way to get there. So that's what my job as the outreach director is geared toward. We do a large push to the rural communities within our 14 state footprint, because most of those people may not even have access to a primary care doctor, let alone if they have a rare type of cancer, their child gets burned unexpectedly, they need a clinical trial, anything of those sorts. So our pilots will typically pick them up in a small airport in their backyard and then fly them to the destination they're trying to get to.
Which is amazing if you think about the fact that the United States, I think we often think we're really close, and technology and the internet has given us this false perspective that everybody has easy access to all the things that we have at our hands. And that's not necessarily true. If you think about just Philadelphia, right, in Children's Hospital, it is the closest children's hospital for many states, but still that is a barrier, right? Like you could be touching tons of states, but states are big. They're like mini countries. Forget
Exactly.
that in the US. So being able to bring specialized care is just amazing because sometimes it's not just the financial piece, it's the distance. And I would love if you could share some stories or maybe just some of your experiences so that listeners can really get like, why it's so important that we focus on the access piece for some of the healthcare that's out there or services out there.
Yeah, definitely. And I totally agree because living so close to Philadelphia, it's kind of, I was in this little bubble my whole life, realizing like, why would anybody have to travel? Like, isn't the best healthcare in their backyard like it is here? But then as I go to these rural communities and present at conferences or just set up meetings with healthcare providers, it's like, wow, some people truly don't have access to any type of specialized care. So if they would need it, it's like maybe it would just be easier to forego that medical care because they think they don't have a way to get there, which is why I try to spread the word as much as I can. But one great example is we have a patient that was actually being treated in Philadelphia for stage 4 cancer. And unfortunately, Fox Chase was unable to help her anymore. So we are currently flying her to a clinical trial at Johns Hopkins in Baltimore. And that's just one example of you may have the best medical care in your backyard, but it may not be best suited for your needs. And there could be a better option out there for you somewhere else. You just have to find a way to get there. So she's a great story. We also are flying a little girl from believe she's from Georgia. Her name's Emma Duke, and she was diagnosed with a rare form of cancer. I believe she's 4 or 5, and we have been flying her up to Children's Hospital Philadelphia. She actually had to stay for an 8-week period to get chemotherapy. So we flew her parents and her up to CHOP, and then we are also providing compassion flights for the rest of their family. So that's just another kind of area of our service. We do the flights for the medical care, but we also provide what are called compassion flights. So especially if mom and dad are with a child at the hospital they're being treated at, but they have other children at home, we kind of switch the parents back out and forth just to kind of keep the families together and limit the disruption at home as much as possible.
That is so wonderful because we talk a lot in the US about how we need to be more empathetic, more compassionate when we think about ourselves as a society and a community, that we need to have more hope. And I can't think of an organization that is actively doing this so much as yours. Like, honestly, the idea that y'all saw a niche, a need, and thought, like, how can we fix this? And that's really kind of the spirit most of us had when we're advocates, right? You see a problem, you want to fix it. And so this volunteer nonprofit group is out here looking at an issue when it comes to travel access for services. And so I heard that not only have you kind of done this for those in need with medical care, but then also for another group that has needed some assistance with the distance. I heard that y'all had also helped, and this is how I got reignited with your organization, the Pennsylvania CASA group, which tends to help children who have judicial access issues and their case help. So tell me how that happened, because that's not traditional medical care or something that people would think of when they think of angel flight.
Yeah, exactly. So they had reached out to us. They heard about our partner organization, Angel Flight South Central, which is based in Texas. They had partnered with a CASA organization in their area. So the one in our territory reached out and said, "Hey, I heard you may be able to help us get to our clients that we may have not seen face to face in a while." So that was just kind of a perfect example of a compassion flight. We flew, I believe, I forget where he came from, but we flew him to Pittsburgh to visit the foster child that he hadn't seen face to face for a while. And especially with COVID, they were doing a lot of virtual conversations. But of course, I never think virtual is the same as being in person. So we set up that flight for him to visit his client and then flew him back home when he was ready to go. And those are just examples of compassion flights that we don't advertise as much just because there's not a specific definition for what it may be. It may be something like we did for CASA, or it may be flying family members to funerals that they may not be able to get to. It's just kind of a wide range of reasons why we would provide those.
Which is why there's just so many reasons to love Angel Flight East. So, I think one of the questions I always ask people is, why is this important? And I'm hoping that listeners are getting the why it's important. But from a healing perspective, when you were talking about compassion flights and being able to also fly parents and support people with patients who need care, as a nurse, I can only weigh in that when you have a support system with you when you're going through care, it can often make a huge difference. And even when you were talking about the case manager or the case advocate, the CASA person flying to see the person face to face, really a big piece, it sounds like, that you're talking about, or what Angel Flight East helps with, is our mental, emotional, spiritual help when we're going through things like this. Not just the access to special services, but I don't know if any listener has ever been sick and wanted someone to just hold their hand who they knew was supportive, or just be in community with supportive people, but you're keeping families intact and supporters intact so that they can really kind of help people manage the most challenging moments of their lives in many cases, which is just so so important. I'd love if you could weigh in a little bit on that. That's how I'm hearing it.
Yeah, I always say so. What they do is you can't even put into words like how important it is. And if you ask any of them why they do it, they just love to fly, and this kind of pairs their hobby with a purpose. But we find that a lot of pilots will routinely fly the same person over and over again. So they also become an extension of that patient support system. Because when you're up in the air, sometimes the flights could be between an hour and a half to 3 hours, maybe. So they say you have to find something to talk about. And some patients just need somebody to talk to because they may live alone or they may not have extended family. So that what the pilots do, obviously the flight is extremely important, but that additional support they're offering our patients, I just think is even more important. And they build these lifelong friendships. And even if somebody stops flying because they got better, they still continue that relationship, keep in touch with one another. One of our favorite stories is we have a little boy in Georgetown, Delaware, and we've been flying him since he was a baby for short gut syndrome to Boston Children's Hospital. And a pilot has been flying him since he was a baby till now. I believe he's about 6 years old. And the mom texted me that they all went on a vacation together in Florida. Yeah,
Gosh,
that
that's
just shows the
amazing.
impact. Yeah. And I was like, what about the Angel Flight East staff? We helped coordinate the flights, but it just shows the importance of how much our pilots are giving, not just thinking about the flying aspect of it, but just giving their time, their emotions, just building those connections to really be whatever they can be for the patients that we fly.
And we often hear negative stories in the news, or we hear stories about people that have done a bad thing, and then we're trying to recover from that. And I'm so happy that I'm able to share this because it's one of those positivity things. So what are some things that you wish, if you had a magic wand, what are some things you wish would magically instantly change when it comes to the services that you provide?
I think I would just wish that more people knew about it because it's also not just Angel Flight East. We're kind of like a small piece of the puzzle. There's over 60 organizations like us across the country. So there's so many volunteer pilots who are doing this incredible, impactful work. And I just think so many people don't know about it because it's not advertised as much. And I also think the social workers that we're always outreaching to are also so overwhelmed with what they have to do day in and day out that it's almost like we don't want another resource. And I just think sometimes our organizations as a whole are almost too good to be true because when you first hear, oh, somebody's going to fly me for free with an airplane, it's like, no, I'm definitely going to get a bill after that. It's
Mm.
like we have to have those challenging conversations too, just to be like, no, it is a legitimate service. These people are doing it at no cost. So I really just wish more people would know about it. Because, like I said earlier, it just breaks my heart because you don't know how many people may just be saying, oh, I can't get to my medical care. That could be life saving. So I'm just not going to go because I don't have a way to get there. It's not financially feasible for me. And they just don't go to their medical care and they just kind of take the care that they get that's closest to home.
That's very true. I had a patient many years ago when I was still a bedside nurse who had a central line. And for those listeners who don't know what a central line is, it's a line where they give life saving treatment, sometimes fluids, often chemotherapy, biotherapy, other things, antibiotics. And it goes right into like the heart access area. And so he had a central line and it had broken. There was a cap that had broken off and it had split. And because he lived so far away in a rural location, he used duct tape and some gauze to just keep it in place. What he thought was best practice because he said, I'm so far away. It's such a big haul to get from where I am down to Philadelphia. I figured this was the best thing and no one could take me. And so access is such a big thing, oftentimes for patients. And then the other thing that I can think about is that I had a distant family member who had a rare cancer. And as an oncology nurse, I knew that sometimes with specialized diseases, or sometimes, the best treatment is not at your local town community hospital. And so I had talked with them and they said, but it's really far and I can't, and I don't know how I would consistently get there. And what would the value be? And so I love that you're saying, that sometimes the best treatment is not in your backyard, but if we can get you to the best treatment, how can we help you get there? And the bill piece is interesting because I can see that a lot of people would think, well, why would you do something this
Hmm.
good for me? Like, what are you going to get out of it? What do I have to do? And there's no cost ever for those who use the service.
And they can use it as often as needed, and there's never a charge, which I think that is also kind of mind-boggling for people to think about. Because really, our only two qualifications are that a person is medically stable and ambulatory to board a small airplane, and then once they're qualified, we can fly them as often as needed.
And so you add a great caveat, which we didn't talk about, but this is not a medical flight. So there are no medical people on board. So that is slightly different than I'm sure some people are imagining, like there's a nurse or someone that can
Hmm.
help you. It's not quite that, but it is the step below that, which is the flight piece. So as Jess said, if you are medically stable and your doctor says, hey, you can go on a flight, right? This is a service. If you're struggling to kind of figure out how you're going to get to a treatment that's far away, but you need, this is a service to reach out to. So I'm going to ask two questions now. So how can listeners kind of like help? How can they, if they want to donate, where do they reach out to y'all? And if there's anything that they listeners can do to help your organization, what would those like two specific tasks and where to find y'all?
So they can definitely find where to donate on our website, angelflighteast.org. So joining our Facebook, Instagram, LinkedIn, Twitter, whatever your kind of favorite platform is, just sharing our stories on those are so helpful. We're a pretty small staff, so there's 5 full-time employees and 1 part-time employee. So sharing our information throughout all the 14 states we cover all the time is pretty much impossible. So we always appreciate anyone who can help us get the word out on our behalf. And then if you are interested in volunteering, there's also a volunteer form on our website that people can fill out. And we have a couple different committees, a board of directors. We have a few fundraising events throughout the year. So there are a variety of ways of that people can volunteer with us too.
That's awesome. And I just want to say, all the nurses, all the social workers, all the doctors out there, right? Angel Flight East. Okay.
Yeah.
Connect them to your patients. Think about this podcast as you listen to it, because health equity is about how do we, in real actionable ways, improve people's health. And one of those things is how do we create, how do we remove some of those barriers? It's not necessarily about equality, but it's about looking at, well, where are some things where we can make improvements? And Angel Flight East is out here helping people get access to specialized services and bridge that distance. So I love what the organization is doing. I truly appreciate you sharing your story and the resources and how they can get involved. So if you're looking to volunteer, check out their site, whether that be as a pilot or as a staff volunteer. If you're looking to access their service, please check out their site. I will have all of this information in our description page and our closeout. This has been just such an amazing chat with you today. I have had the privilege of getting to meet lots of different people as I've been doing this health equity podcast. And When we see action in healthcare, I like to shout those out.
Yeah.
And Angel Flight East is definitely an action in healthcare organization. So, for those people who are not just looking for the theoretical philosophy, how can I change my thinking? This is an action organization. So, if you're looking to volunteer, if you're looking to spread the word about how to improve healthcare or health access, this is one of those groups I really encourage you to join their social media and spread the word. Jess, thank you so much for being here. I appreciate you sharing your story and the great work that you're doing with Angel Flight East. And now, listeners, I would love if you subscribe not just to Angel Flight East's social media channels and follow them, but also subscribe to our podcast. This way, you'll never miss a moment of our thought-provoking episodes. Together, let's amplify the voices driving positive change in healthcare accessibility, wellness, and health equity overall. Thank you so much for being here, and we appreciate our listeners and all of our guests.